Niagara Health has finally been able to take a deep breath and celebrate some of their superstars for the first time since the start of the pandemic. Their awards of excellence were handed out last week, 9 awards presented, and we have the winner of the Achieving Ambitious Results Award, Dr. Jennifer Frendo. Congratulations on your award.
Thank you so very much, Mike. I really appreciate it.
Were you taken aback by being honored?
I was. I mean, there's been so many contributors doing their part in the pandemic that there's so many people to choose from. So I was quite honored that my colleagues nominated me, and lo and behold, I won this one. So that's very kind.
I remember going back near the beginning of the pandemic and reading something on the Niagara Health website about you stepping up and being one of the first physicians to put your name forward as someone who was going to be helping out during the pandemic. And you were involved in the assessments, the vaccination clinics, and also the treatment clinics. So you were involved in all of it, helping to schedule other doctors as well. Was that challenging?
Oh my goodness. Yeah, it was challenging. It was basically, hitting the ground running. I'll never remember the day because it was March 16th, 2020. And that was basically the day that became the force that would consume my life for the next 2+ years. And I didn't really know at the time. We had all been hearing murmurings leading up to what was then declared the pandemic, about what was going to be happening in the world. And that's always a possibility on the horizon, whether it be a natural disaster that you have to help contribute with, or a public health disaster. And so I had been in touch with Dr. Kareem Ali, our medical director of infectious diseases, and said, there's this burgeoning tsunami potentially coming our way. I said, what's Niagara's plan? Like, I think you're going to need to recruit as much help as you can from the community. And I said, if you need help, let me know, and I'll see who I can rally up. And basically, he gave me the call at like 5 o'clock on a Monday. That was the day that from then on in, ORs were emergencies only. Everything started to get canceled. And he says, Jen, we're going to need help. I said, what can I do? He says, just start calling, seeing. We need to set up assessment centers. I said, how soon? He says, 2 days. I said, oh, okay, that's ambitious, but we'll do it. So I finished with a discussion with him, and basically just started brainstorming on my drive back home to Niagara Lake. Basically started calling, emailing, texting, whoever I could think of that would be willing to just start stepping up to the plate as soon as possible. It was basically, seeing the need and responding. And then, it was almost like whack-a-mole. It's like, oh, okay, we got to do this different. We got to do that. Okay, let's step up and change this. Oh, we have one site, now we need 2 sites. Oh, we have 1 doc, now we need 2. It was just ballooning on a very rapid scale.
Were you surprised at how, I guess, welcoming all of the physicians were to helping out?
I wasn't so much surprised as I was heartwarmed. I knew my colleagues. I knew that they would step up to the plate, that they would, step up to that task. And the fact that they all kind of came and said, yeah, I can do this, I can do that. It was great. Like, while it was a crazy amount of work to coordinate it all, I knew they would do it. I knew they would. And it's not just my colleagues in medicine. It was my nursing colleagues. It was allied healthcare colleagues. Like, we all basically came, we all had our credentials, we left all that at the door and just pulled together as a team.
Are things getting back to normal for you as a family physician now?
For the most part. I mean, initially in that first part of the pandemic, it was 16-hour days because, I was working my office as normal, like, even though we had to kind of quickly pivot and do everything virtually. But then then I had to, fill in all of the scheduling and contacting and, finding the latest information that I needed to disseminate to people and figuring out, how, just the logistics of it. And luckily I have a very patient husband who, made sure I was fed, made sure I was getting sleep, making sure he was taking care of whatever he could do so that I could just keep putting all this energy into this.